Welcome to Law Chat with Girija, my entrepreneur friends. I'm Girija Parka Patel, and I'm a mother, a wife, a daughter, a sister, a businesswoman, a lawyer, and an entrepreneur, just like you. I believe in the power of storytelling and mentorship through stories. Whether 6 months in or 20 years in their journey, entrepreneurs have impactful experiences to share, which are full of mistakes and full of victories. And my goal is to highlight those and to celebrate the diverse narratives and perspectives in the world of entrepreneurship, which inevitably provides motivation, encouragement, and inspiration to our community and to our own journey. So Law Chat's purpose is not just to share the expected conversations about their businesses and journey, but also I want to share and dive deep into their details. Get nosy, get personal, and learn from their pivotal journey and their mistakes, and also, again, their victories. So I'm here to use those moments to inspire and to motivate you on your own journey. And of course, we can't run away from the law. After all, this is Law Chat with Girija. So let's dive in. Hey everyone, welcome to another episode of Law Chat. Today's Law Chat is so special to me. I will be chatting with my good friend, Dr. Natasha Kathuria. She works as an emergency medicine physician in Austin, Texas, and she's also a medical journalist. She currently serves on the board of directors for an NGO called Global Outreach Doctors. She's trained as a global health specialist. She has completed her fellowship at Mount Sinai Medical Center and her master's in public health and epidemiology from Columbia. Through her career, she has extensive humanitarian experience in South America and parts of Africa. She's so accomplished, and there's so much more that she has done. More than anything, she has a heart of gold, and she is beautiful inside and out. And I'm just so excited to have her on the show today so we can chat about all her accomplishments and also learn how she navigated even as a professional. So welcome to the show, Dr. Natasha Kathuria.
Hello, thank you for having me. So excited to be here.
Thank you so much. I am so grateful for you to be here. I'm so grateful for you to be a friend of mine. It's just been so wonderful getting to know you more and more. So I'm so happy that you are here with us today.
Yay, me too.
Tell me, is there anything else that you'd like to share before we dive in?
Nope, not really. I'm just, in the middle of COVID-19 right now. So the world is very busy for all of us on the front lines. But yeah, no, that was great.
I know. As we're speaking, we currently have Hurricane Laura that is, coming our way. But luckily, I'm grateful that it's not coming to Houston, but unfortunately it's coming to our neighbors, which is really sad also. But I don't know how much more 2020 can offer us, but really, it's showing how resilient we are as humans and as communities. And, I know that I'm really fast forwarding. I want to rewind in just a bit also and learn about where you started and how you became a doctor and where all that came from. But I know during the COVID-19, you were on the front lines, and you and your friends and the other doctor friends who are on the front lines. So thank you so much for all that you have done and all that you are doing, because I know you are really, talking about what's happening, and, it's kind of, you're bringing it out for the public to know also.
Yeah, it's been a rough ride, that's for sure. My colleagues in New York definitely took a beating, and we thought we were, free of that in Texas, and then it came our way, and we all had the same surge. It's not quite as bad, but a similar surge here. And so we're still in it, but we're getting better. And so it's been a ride. It's really made us grow though as people, and but like you said, it really just proves our resilience and has made us really grateful for the little things that we have.
I know. I've really enjoyed, whenever you've posted on your own social media or, Facebook or Instagram about, it's almost like you're a champion for, hey, wear your mask. Hey, let's be safe. Things that, I feel like it should be like, just do it for the safety of others. Just do it for the safety of your community. Whether you believe it or not, it's irrelevant at the moment. And it's just kind of like, I'm like, well, why would doctors wear masks in surgery if it wasn't needed? So I don't get it. So it's kind
of
like,
trust me, I feel ya. It's really sad that we have to push for really basic things for people to do to protect themselves. But here we are, it's 2020. So, everything that we never thought would be a challenge, everything has proven a challenge. So we're trying our best,
Well,
just keeping people healthy.
yeah, and I think you're just so gracefully sharing that information every time you do talk about it. So thank you for that. So tell me, where did this all start? Where did this desire to be a doctor and to be this amazing humanitarian start? Because not a lot of people are like you. So tell me, where did this start?
Well, contrary, I think, to what a lot of people think, I don't have any physicians in my family other than now my brother, but I knew nothing about medicine. My dad's an engineer. My mom got her engineering license later. They worked together. They're more of the like math side of the family, and I kind of grew up around technology, and actually I was very into computer programming when I was younger. I thought I would do computer programming as a career. I was really into tech and all that kind of stuff. And then when I was in college, I changed my course like so many times. I actually started off as Spanish and economics, double majors. And I was like, I'm going to do international business or computer programming. I'm going to figure it out. And then, I went on a trip that pretty much kind of changed everything for me. I'm Zoroastrian, so I'm Persian, but my parents were born and raised in India and Bombay, or Mumbai now. But we spent every other summer pretty much since we were 2 in India with our family. And it was great. We loved it. It was like our second home. And it, very normal for us to see that type of lifestyle, a developing country, and, everything. It was so normal to me. I didn't really realize it was abnormal. I tell this to people all the time. It was kind of like having this epiphany that my parents had accents. I was like, my parents don't have accents. And then I kind of realized it. And I was like, oh my goodness, my parents have accents. It was kind of like this moment where I was like, oh my gosh, India is a developing country. Like, that's not normal. And in college, my brother, he was at a different university than I was, and we kind of teamed up together, and we went with this group of doctors to India for the first time, not visiting for fun and to visit family. And it was really interesting. I didn't want to do medicine at that time. Neither did he. He was biomedical engineering. I was thinking about, the tech side of things. And we were just curious. We wanted to just give back to India for all it kind of had given my ancestors. And it was just mind blowing. It was the first time I really connected with the poor in India and the people who are completely marginalized. And it was to this day, one of the most incredible trips of my life. And I remember coming back with my brother and just being like, on the flight home, I was just crying. And I was like, I can't believe we've gone to India so many times. And it's so easy to turn a blind eye to what so much of the world is going through. And I really wanted to help and do something. So I came back, and I was in college, and I didn't know for sure if I was going to be pre-med yet. I was a sophomore, and I decided to start an NGO that pretty much put university students on these international trips, because I was like, it totally changed my life. If I never did that, if my brother never did that, I don't know if either of us would be doctors today. I don't know if we would be on this path, because we didn't grow up with doctor parents or doctor, grandparents. And so I started this group. I still remember the first trip because I was on it. We went to Costa Rica, and, every year we sent trip after trip of university students, and they all came back with this same, just good feeling that you don't forget, whether or not you ever go on a trip again, whether or not you go into medicine or law or anything, just that desire to help the people who don't have a voice. And yeah, that's pretty much what I knew I wanted to do global health before medicine. Then I did medicine, and then I chose emergency medicine because I knew I wanted to do global health on a system level and help build emergency medicine systems, not just go volunteer and treat patients, but kind of make a bigger, broader impact. So that's kind of what took me down this path.
That's incredible. So when you went on that first doctor trip, how did you meet these doctors? How did you, are they family friends, or are they just an organization that your brother happened to run into and they're like, oh, join us on this trip to India? How did you figure that out?
It was so random. I actually didn't know anybody on the trip, and my brother definitely didn't. I was the one who told him about it, but it was a friend of a friend's parent who was running it. He's a surgeon in Florida where I grew up, and it's called the Doctors Goodwill Foundation, and it's like a non-religious trip. It's just a medical trip of surgeons mostly that go and they operate. And then some primary doctors went with them, and they would always take, students to kind of teach them. And someone knew that I was interested and that I'd been to India a lot. And they were like, hey, there's this trip going, and, I'm sure they'd love to have you. And I was like, can my brother come with me? Because I don't want to go alone. I've never been to India alone, and traveling by train by myself.
Yeah.
It was great. Life-changing for sure.
That's so crazy. How old were you back then? Like when you did that?
That was during my freshman year of college, the December of my freshman year. So Christmas break of freshman year.
Right. Wow.
So still a newbie.
Still a newbie. Yeah. That's incredible, because I feel like it's so hard, because a lot of times when people are going into college, they just don't even know half the time what they're doing. They're just kind of going, and then they'll follow whatever usually their parents are saying to do, and you're kind of like, okay, I'll do that. That sounds great to me.
Yeah.
And then later on, maybe you'll have that epiphany, but maybe 20 years down the road. So I think it's so cool how you not only had that insight, but then you're also helping others gain that insight at an earlier age by giving them exposure. So did you start the Global Outreach Doctors?
No, I started a different NGO. It was called Heal the World, and that was that was the next year of college, my sophomore year. And then Global Outreach Doctors I started working for actually just since I moved from New York to Austin, so in the past year. And so I work on their board, but totally different organization.
Wow. So Heal the World, is it still active, or is it something that you did for a little bit and now it's just kind of faded away?
Yeah, it's definitely still active. I ran it while I was in college, and then when I realized I got into med school and I couldn't run it anymore, or I would have no room to breathe, I transitioned it over actually to the university. So the University of Florida took over ownership of it. So now it's got constant funding from the university. It's like a permanent entity on campus, and it sends pretty much just the university undergrads and grad students out on these trips every year. So now it's definitely a university affiliated group. It's not its own entity anymore. But it, that was something that it was a tough choice to make, but I think it was the single best choice to keep that organization going to this day.
Yeah, you have left a legacy at the university. You didn't just start something and say, peace out, I'm going to med school now, I'll see you later. You left a legacy there. That is so incredible. But even starting that program takes guts, it takes courage, and it also takes, having some type of a purpose. And that's so cool that you were able to create that and leave a legacy behind for others to experiment and to get, exposure also at the same time. So that's really cool. I mean, honestly, like, you should be so proud of yourself.
Oh, thanks.
Yeah.
It's weird. I always think back and I think, like, what was it? Like, it's hard to look back and think, like, what was that tipping point that made, someone go into something? And, it's the question every person gets when they apply to med school. Like, well, what makes you want to be a doctor? What made you? And it's always like some scripted answer that you like think over, like what's going to impress the interviewees and interviewers.
Yeah.
And, the weird thing is, I think just the way I grew up, I'm just like in a unique place. I think being a Zoroastrian, there's like none of us. There's less than 100,000 in the world, and there's like, 10 in Orlando. I grew up, we all know each other, and it's being like a super minority. You kind of just grow up loving everybody because you can't think you're better than other people when there's so few of you. So you really just like, I grew up just kind of appreciating everything, like every culture, every religion, every race. I thought everything was so fascinating. And, knowing kind of what my ancestors went through leaving Iran and going to India, and my grandparents, it wasn't even that far away. These are like my mom's parents. And, all that India gave them as refugees pretty much, and how they were able to survive that. And really, I was able to witness the fruits of that through my parents, really made me realize that it would be a real big shame if I went through my entire life not doing anything to give back to the world that has given so much to my family that otherwise, we'd be extinct for sure by now. There would be no question. So that was kind of definitely the tipping point to get me to go to India to give back
Mm-hmm.
for what India gave my family. And
Mm-hmm.
that led to all of this. So
All the
it's
other
kind of
tipping
crazy.
points that I think the perspective is it's so unique. You're right, because not a lot of people would think that, because I think your perspective should not just be limited to you because there's so few of you. That perspective should be permeating through everybody, because at the end of the day, there's only one of me. Yes, there might be many of my kind or whatever you want to call it, but what is my kind? And so it's like,
Awesome.
the awesome kind, yeah. But it's like, yeah, I mean, you can be defined in so many different ways, right? I am an American, I am an Indian heritage, I am a woman, I am a mother. How many hats do we all wear? And I think that's such a beautiful perspective to say, I just want to give back to the world. I gave so much to my family, because we are in a privileged position to say that. I think you're right. I still go to India quite often. And so when you do go, you do see the poverty there. And it's really sad. And unfortunately, what happens, I think, is everyone that does see it, and they're so used to it, and it just becomes part of their daily life rather than something where they want to make a difference in. And it takes so much to pick yourself up and say, okay, I'm going to make a difference. I'm going to really make an intentional difference, and I'm going to leave that legacy behind also. And so that's really cool. So how many times have you, that one time that you went, which was that changed your life, the second time you went to Peru, and then after that, what else have you done? What other?
Yeah. So I went to India that year, and then Costa Rica, and then, we kind of launched all these trips, but I was doing more of the like managing the trip role from campus. So I couldn't go obviously on every trip. And then when I went to med school, that's when I realized, I have some knowledge. Now I can use some of my knowledge and, be more than just a hand. So that was my first trip to Africa. I went to Uganda for the summer, 1 year in college. Another unbelievably life-changing moment. Also, it was so funny because I'll never forget them like warning us and sitting us down before the trip and being like, hey, some of you have never seen poverty like this before. I was like, oh my gosh, I can't imagine. And then I went, and don't get me wrong, there's a lot of poverty, but I'm like, have y'all been to India? Like, the
Yeah.
poverty is so much denser there. Like, it's everywhere.
It's sad. It's sad, actually. It's sad to the point where you do get tears, and not just because you're seeing the poverty, but I don't know, when I went in, immersed myself in that very intentionally, I got tears out of gratitude and tears of knowing that, wow, I'm so blessed right now. And so, yeah, I can imagine.
Yeah.
And I think you're right. There's a lot of that people have not been exposed to here, living in the States or in other very developed countries, because when you do go, you generally go on a tour and everything is very beautiful. So,
Right.
so,
Oh, of course. Yeah.
yeah. So when you go on these trips and, these humanitarian trips, what are you doing? What are some of the steps that you're taking to help? And then what is the expectation?
So they're all very different depending on the trip. As you can imagine, they range everywhere from clinical work to education to political system work to research. Depends on the organization kind of that we linked with.
Mm-hmm.
The ones in college and for the university students, those are very different. Those are just like immersive experiences. You team up with a group of doctors or educators or whoever it was, and you're kind of there to witness it, be a helping hand. As a college student, there's not much more they could do. But after that, there was a really interesting publication that came out from a med student at Harvard or Yale, I can't remember, when I was in college applying to med school, and it was called Duffel Bag Medicine. And that was another complete tipping point in my life, where it was really interesting to read this fourth year med student's perspective on global health. And it was like everything that, I felt deep inside, but I didn't want to, the cognitive dissonance of like, no, I'm not doing anything wrong. I'm doing a great thing. I'm going and helping the world. How could anything be wrong with that? But I read that article and it was so interesting. And it really called out these global health trips that were short, like a week or two, doing clinical work. You set up a tent, you bring your duffel bag of medicine, and you provide clinical care. And, they actually looked at the outcomes of that. They're not that great.
No.
It's weird to think it's kind of like this. It's like you feel good because you're doing it, but what is the actual impact on the community? It's not that great, because you're setting up a temporary clinic, you're giving care that's not sustainable. It's like Band-Aid medicine. You're putting a Band-Aid on a huge problem. It's not going to do anything. So pretty much from med school on, every trip I went on and partnered with, and through my fellowship, that's a big reason I did my fellowship, was to make sure that I'm doing my due diligence to do the right type of global health work, which is system-based, sustainable care. So they're all different. A lot of them were teaching, an ER doctor, emergency medicine is not a specialty in most of the world. So, ER, they don't even have ERs. They just have little triage clinics. Like, the preventable causes of death are through the roof there. So a lot of these developing countries, we were just trying to teach doctors how to practice emergency medicine, how to use an ultrasound machine, things that were long lasting, working with the Ministry of Health to figure out where to allocate resources. How do we build ambulance companies? How do we kind of help the infrastructure grow to support those kind of things? And those were not as short-term gratifying as a clinical medicine, where you're like, I just fixed this guy's arm, I did a great thing. It's like long-term hard work, but you leave really feeling like, all right, I think I made a difference for this country, rather than I think I made a difference for that 4-year-old I saw. It's a totally different mindset.
Right. And that's actually brilliant. And then, was there a gap there? Was there a void that you filled with your work and your, the way you were approaching global health?
Yeah, I think in terms of being a physician here and being able to travel and practice medicine in developing countries, you definitely get to be a lot more present, I think. You get to practice medicine with the basics. You don't have the luxuries of all these fancy technology and MRI machines and CT scanners, and you don't even have specialists. You're doing things that you never do on a normal day-to-day basis here, and you get the gratitude from your patients that you're like, I could have done so much better if we were in America, and you're so much more grateful here. Like, it's crazy, and it just that you come back with so much more. And I think that really goes into the patients then when we come back here. Like, I'll go work for a month or 2 months or whatever in another country, and then when I come back, it's like, I'm filled for 6 months of like all that gratitude that the patients gave me there, I can now give back here. Otherwise, physicians get burnt out here. There's a lot of red tape. It's corporate medicine now. Things are different. It's hard to just focus on the patient and really making the patient feel good and being present when you're worried about all the other things in the background, being like, do this, check this off, make sure you make it on this time. And, so
Yeah.
it really helps a lot. It fills that void for sure. Definitely.
Yeah. And then, when you started the global health missions that you go on, is it through global outreach, or are you doing it on your own, or is it through global outreach doctors?
So my role with global outreach doctors is just as a board to help them make decisions. So I'm not actually traveling with their teams. They have, we kind of do the logistics side of it. So we're helping decide what projects are worth it, what are important initiatives, and make like the decisions more than traveling. So, and in since I moved to Austin, I haven't traveled. So in the last 2 years, I haven't gone on any global health trips, because I've been kind of doing more the journalism side of public health, especially with COVID-19. It's been really important to, use that side and really help our country right now, because there's no way that, the red tape for traveling, and unfortunately, the global health trips are just falling apart. Like, malaria rates are through the roof. Everything else is falling apart. But, our hands are a little bit tied right now.
Wow. So I didn't even think about that, what you just said, because the global trips and the health trips are reducing, naturally so, because travel has reduced, that other parts of the world are maybe experiencing impact from other diseases that were probably at a low. What do you see that's happening?
I think it's just like, it's always going to be like a net amount of energy that we kind of have in this world. So even in the healthcare system, like, there's we have one bucket of funding, and if we use a ton of the funding for COVID-19, then you're losing it to malaria and
Mm-hmm.
HIV and tuberculosis and trauma
Mm-hmm.
and everything else. And not necessarily quite that black and white, but that's the best kind of overall picture I can give to it. And I mean, we've seen the whole world is suffering, the developing countries the most, of otherwise preventable causes of death, including America. Our excess
Mm-hmm.
death rate is tremendous, arguably higher than our death rate from COVID-19, just because of COVID-19. So we're all worried about the 177,000 people who died to this point of COVID, not realizing we've had like 500,000 excess deaths from other things because of COVID, because we've had to shut down elective cases. We've had to, people aren't getting their cancer treatments and their cancer surgeries when there's surges, and people are afraid to go to their doctors, afraid to come to the ER on time.
Mm-hmm.
Managing the public sphere while keeping them having this sense of urgency is extremely challenging. And on a global health level, it's funding. It's not so much the fear, it's the resources. So all these research initiatives from universities, from the states, that go out there and help fund these, and things like UNICEF, the Red Cross, there's only so much to go around, and they have to make these high level decisions on what's time sensitive and emergent. The urgent stuff can wait, but how do we deal with the emergent thing to make sure it doesn't become endemic and just here all the time?
Mm-hmm. Mm-hmm. That must be so hard, watching it unravel. It must be so hard also not be able to make a bigger impact, I guess, in this situation as a doctor. I don't know. I mean, as an individual who's not a doctor, who has zero medical anything, but I'm like, no, thank you. But, I feel so helpless. I feel like, my gosh, what can I do? And there is very limited of what I can do, right? Besides being patient and besides showing grace to everybody around me and to myself. But I mean, there's so much, there's not as much as I could do as I wish I could do, I guess. I hate to interrupt this awesome conversation, but I have to stop and talk with you about the number one thing I'm asked about by entrepreneurs: contracts. They're vital to any business relationship and to protect your business. But I also know that entrepreneurs, especially when you're starting up, money is tight. But I would never want you to compromise on a strong legal foundation. So enter yourcontractbuddy.com, a website created by me with contract templates created and drafted by me and fellow industry partners. They're ready to use and easy to plug in immediately. And they are not restricted to any specific state. So yourcontractbuddy.com is sponsoring this episode, and you and your listener can get 10% off right now with code LawChat. Yes, you heard me right. 10% off right now with code LawChat. And now, back to our awesome conversation. So as a doctor who has a skill set to do stuff, it must be so frustrating at times that you just can't do what you think is the right thing to do.
Yes, it's frustrating. I think it's a reminder that no matter where you are on the totem pole,
Yeah.
I think everyone is feeling like they could be doing more and they're not doing enough. They don't understand what's going on well enough, whether it's, the head of the CDC or it's, the janitor down the street. It's like everyone, I think, maybe not everyone, I'll take that back, but I think most people, most selfless people, I should say, have that sense of, wanting to help, especially when this first started and there was just patriotism and support of healthcare workers and everything. Everyone wanted to be a part and not knowing how to put their energy in. But people did incredible things. I have a friend in Austin who had no medical knowledge, not in the healthcare field at all, has his own startup company, doing really well. And when COVID hit, he was like, I'm going to do something. And he shifted all of his funding and his research and is now making 2,000 surgical masks a day through his company.
Wow.
And crazy what people have done to really give back.
Yeah.
And, not necessarily profit off of the pandemic, but do great things and really, be groundbreakers through this. And it's been amazing to see.
Mm-hmm. Truly, I think that this is the time during the pandemic where either you witnessed the depth of somebody's character in the sense of who they are, either you witnessed the scary or you witnessed such selflessness coming out of people. And not to say one couldn't be the other, but it's more like there was just these moments that we were just like, wow, where you were just like, this is amazing. You are amazing. So,
Yeah.
I mean,
It's true.
like I see what you do, and then of course I see other people who are doctors who are not doctors, and it's really impressive. It's also inspiring because it's kind of like you're taking your profession or your business and you're adapting, and then you're also trying to do goodwill, which I think is so huge when you can carve out goodwill or intentional giving back at a time when you are hurting or when you could be hurting as well. So kudos to your friend.
Yeah. I know, right? I was like, you're doing
Yeah.
probably more than I am right now. That's
Yeah.
amazing.
So I keep hearing that, I feel like your passion is world health. Like that's something where you first started that and then you're like, this is what I'm going to do as an ER doctor. And so tell me, like, what are some, I'm sure you have some awesome stories, really like inspiring stories also. Can you share one of them with us?
Oh man. Yeah, I can. So I'll start with, I guess I'll tell you a global health story. Was the the single most memorable case in my entire life and totally unexpected. So I trained in Atlanta. I worked in New York City for years. I worked in one of the busiest trauma centers in the country. Like I've seen things that, you know, you never thought you'd have to see.
Yeah.
But I will tell you, it is always different in the field. So when it comes in on a stretcher by an ambulance, it's a totally different mindset. It's like you're a sports team, you're going in, you're going to fight, you're all together, you handle it. And, it's just, you do it and it's fun. It's like exciting and it's not so terrifying. But when you see something happen in the field, like outside, unexpectedly, it is so much more emotionally jarring and, difficult. And I was in Mozambique. It was during my fellowship. I was working in Mozambique, and we would take like every other weekend and travel around the country, go to the beach, relax, kind of get a breath of fresh air, then go back to work.
Mm-hmm.
And we were at this remote beach, me and my senior fellow, and it was just the two of us. And we were out on a boat, just like a little tiny fisherman's boat, not like some fancy yacht, right? It's Mozambique in Africa. So
Yeah.
we were out there, and there were two Brazilians who were also volunteering in the area that came on the boat with us.
Mm-hmm.
We all went out. We just went swimming and kind of snorkeling around, and then we ran our way back, and there were a bunch of little kids swimming in the ocean, kind of just past the waves. So it's too deep to stand. And we were kind of making it back to shore. And all of a sudden, I was like, there were three kids there. Now there's just two. And I couldn't see the third kid. And I was just watching them because they're kids having fun. And all of a sudden, we saw this kid kind of disappear and then pop up floating face down. And I just looked at my senior fellow and I was like, I think that kid just had a seizure and drowned or something. Like,
Yeah.
he's drowned. Like, we have to save him. We were too far. So we jumped in and swam with him. I mean, swimming with a, lifeless body is very difficult. So it was the hardest thing I've done. And we made it shore. It was not that far at the time. The waves definitely helped us out, pushed him with us, and he was tiny. And we just started CPR on this kid. And I just remember being like, not today. Like, this is not happening here. Like, we've been here, and this literally our job there was to build emergency medicine. There's no ambulances, there's no ERs like in that area. And we were like, there's nowhere, there's no 911, like there's no one to help this kid. He would have died for sure. Yeah. And we did CPR, and he lived, and he threw up, and we flipped him over, and he kind of stared at us, that like normally happens after someone's, resuscitated from a drowning. They have this moment of shock, and he was just looking around. And I just remember the hug he gave me after. I just couldn't stop crying. I was like, this is crazy. We do CPR all the time. We bring me back. This is like the most memorable. I'll never forget it. And that was,
goodness.
The longest, I don't know what it was, 2-3 minutes of CPR in my life. Felt like a year, and incredible, and a reminder, like the little things to be really grateful for, like an ambulance, the ability to call 911, like
it also was a reminder,
lifeguards.
Right? It was a reminder of why you're doing what you're doing, also trying to systemically lay a good, solid medical foundation in these countries and in these small cities. And
Yeah.
that is incredible. I mean, I feel like I've used the word incredible 1,000 times while talking to you, but I actually got chills. I got chills listening to you because that is like, wow. I mean, to be able to say that it's like what you see on TV or, you know, the TV shows, the medical TV shows, and you're just like, that's where the inspiration comes from, the real life. So I feel
Yeah.
like, and I could be wrong, I know that you had put something on your Instagram about a picture. Was that, and you and your colleagues with that kid who you saved? Was it that?
He wasn't in the picture. But that was it. That was right after,
Yeah.
we all hung out for a while and detoxed. And then we're like, we have to take a picture of this so we never forget it. And that was the two, me, my senior fellow, the two Brazilians that were on the boat with us. And then I think two of the guys who were guiding the boat.
Yeah.
So, everyone jumped in and, Kyle, my fellow, and I, kind of took the kid and they went back to the boat and came. It was crazy. It was, I don't know what I would have done. I don't know. I'm so grateful every day that that kid survived because that would have been
You were
so
there for a
devastating in that
reason.
moment.
You were placed in that moment for a reason. You were literally his angel that day. Like you and your
Yeah.
colleague were both his angels that day. Like that's why you were there. There was no other purpose for you to be there. And that
Yeah.
is so incredible to know that because I feel like you are serving such a bigger purpose than just being an ER doctor. And I mean, when I say that also with a lot of respect, because it's not just being an ER doctor. I know it takes a lot to be an ER doctor. But I mean, like you are just really impacting other countries on a global level and changing the way they look at medicine and changing the way they look at how to be active when there is an emergency. I mean, I know in India, even today, there's like public service announcements on TV commercials. Hey, if you see an ambulance, please move out of the way. Because even that's not given. Even that,
Right.
here we all move to the side. Ambulance, police officer, firefighter, whatever, anything emergency, we are required to move to the side in America, and we do. But in other parts of the world, even that simple basic thing does not happen. And I have seen people that have died on the streets because they haven't afforded that basic emergency care. And
Right.
so it is, again, I'm going to use the word incredible. It is incredible what you are doing.
It's so
So tell me
funny.
what other things are you doing that is like, disrupting the medical systems and the fields and how so I know you haven't gone on the last 2 years, you haven't done a trip. Are you planning to do one as soon as COVID is done? And, how else are you disrupting the whole medical scene?
Yeah. So I'm trying to figure that out as we speak. But I think right now, so I also work as a freelance journalist. So I started that when my third year of residency. I went to New York and I worked at ABC News in their medical unit at the end of my second year, between second and third year. And I
Mm-hmm.
really wanted to know what is this whole, scene about with journalism. And I loved writing. I was a writer and I was doing a lot of print journalism pieces. And I was writing for them when I was there. And I worked with Richard Besser when he was their big medical correspondent. Amazing guy. I can't say it enough. He is a heart of gold. Like there is no one I've
Mm-hmm.
met who's a physician and a journalist that pure of heart. And it really reminded me. He used to be really high up at the CDC, and he kind of went on air because he was covering anthrax when anthrax was an issue, and he had to
Mm-hmm.
speak about it, and that's kind of what launched his career in journalism. And I remember meeting with him and him telling me, like, you have these tipping points, like I was saying earlier, throughout your career that really give you an opportunity to take a different path. And it's very easy to stay on the path you're on and to stay in your comfort zone because it's comfortable and it's secure. And especially in medicine, I mean, there's so much job security. Why would you leave? Like, why would you venture out and try something new and crazy and super high risk? And he was like, I just remember him telling me, like, you're going to have this happen in your life at some point. And he's like, don't miss the opportunity. Whether or not it comes of anything, he's like, it's going to change you in some way. And
Mm-hmm.
that's going to be a moment. And not just for medicine, I think for everyone, you know, taking risks like you right now, like, you know, you're totally shifting your career and it's incredible. And you're allowing other people to benefit from it. And I've seen all the stuff he's covered over the years, and now he's retired from journalism. He's still a physician and working in research. And I really just, you know, am trying to serve in a public health way through the media as much as I can. There's a frustrating, endless amount of misinformation always, and it's just amplified since COVID-19
Mm-hmm.
and
Mm-hmm.
conspiracy theories and politicization of public health and
WhatsApp news. Can we talk about that? No,
oh my gosh, I know, right? But it's been crazy, and it's exhausting, and it's
mm-hmm.
more stressful than managing a COVID patient or managing the ER and
Mm-hmm.
having multiple critical patients is coming home and going on social media and having to fight misinformation. And it just, there's nothing that hurts us more. Every physician, I know every one of them is like emotionally so affected by it right now, because it's like, you just feel really devalued, and you feel like, why aren't people doing the things we need them to do to help us help them? And it's frustrating. And so I'm hoping, you know, I've been doing a lot of coverage since March, locally in Austin, and now on national and international networks, to kind of bring, you know, our voice from the front lines and, you know, evidence-based medicine in a digestible way to the public that isn't out there right now. I mean, it is in small snippets, but a lot of the stuff they're covering is either super sensationalized or it's minimizing everything. I mean, obviously it depends on what network you're on and what network you're watching. And a lot of it's anecdotal evidence and not really the epidemiologic global perspective. And this is public health, which is different from medicine, you know, and my public health background and is totally different. It really gives me a lens to look at this as like, this is not what's happening in your town. This is what's happening in the country. This is, you know, systemic change, public health initiatives, policy changes, from everything from smoking cessation. I mean, the biggest things that made people quit smoking was not trying to convince them that smoking caused lung cancer. You know, the irony of it is smokers think smoking causes lung cancer way more than non-smokers. And they also think it causes an irrationally high level of lung cancer. And these are people who smoke every day. Like, the fear of that is not what makes them not smoke. What's changed smoking is taxing cigarettes. It's changing laws, like no smoking on a plane, no smoking in indoor closed setting, like those kinds of things.
The restrictions.
Right. The like public health changes, like seatbelts, and how much that has helped us in the ER with trauma and mortality from car accidents. Like, those high level public health changes are what sets our country apart from other countries.
Right.
Hands
right.
down.
And that's
like,
exactly
what keeps us safe.
And that's almost kind of like what you are trying to also influence in other countries when you go into them. Like, when you're going to parts of Africa, or when you're going to parts of South America or South Asia, you're trying to influence their public health policies. It's not just like, hey, you need to do this, but it's like, hey, this is why you need to do it. This is how it works. And you're using America as an example, or other developed countries as an example.
Yeah, exactly.
So I
and
think
like, we obviously are.
It's pretty ironic that it's kind of like almost counterintuitive to what's happening here versus, you know, like, so that's really cool. So I know you had just talked about how people are talking, and also how, you know, the medical professionals are being undervalued. What mindset do you need to have, whether it's somebody devaluing you, or, you know, or even like saying, hey, that's not okay for you to do because you are, you know, you're a woman, or you are XYZ, or anything. Like, how do you break through that mindset, and how do you break through those barriers or limitations that people put over you?
Oh yeah. It's difficult. I think, you know, it's funny. My husband doesn't really like my glasses, and he doesn't like that I wear glasses, but I wear them every day to work because I'm like if I don't wear glasses, people don't take me seriously. They think I'm young and they don't see me as a professional as much. Like a lot of ER doctors don't wear white coats because they're constantly, there's blood everywhere. Like, and a lot of times I'm like, all right, well, I should be wearing a white coat, because if I don't do the things that my husband, he's also an ER doctor, he doesn't have to do that. He doesn't have to wear glasses or a white coat. He's taken seriously because he's a guy. We don't want to admit that, but it is a fact of life, I would say, in our society right now. It's that if you're young, if you're female, you know, people don't take you quite as seriously and don't value your education. They put you in a box, and it's hard for them to think out that you could be out of that box, because in their mind, every woman sits in that box. And how could there be someone out of that box? Like, that's out of the norm. You know, just like stereotyping. They stereotype me as, you know, what they think traditionally based on the way that they grew up, a young female is like. And, you know, that's been definitely a steep learning curve. And it's not just with patients. It's also with my nurses and, you know, techs and staff. You know, I mean, even when I was a fellow, you go med school, residency, fellowship. So, and then attending. Attending is the end. It just means you're a teacher, you're the doc, you've finished training. And so during my fellowship, I was teaching residents. That's normal. You have residents under you and med students under them. And I remember I was younger than easily half of my residents as their fellow. And I was a female. And I was like, this is going to be so hard to be taken seriously. And it weirdly, you know, I remember before I started thinking, I can think of this as a barrier, as a mountain I have to climb, and see it as a disadvantage, or I can use it to my advantage. And I chose to use it to my advantage. I got closer to my residents than the attendings could get. Like we could be friends, and I could teach them as their colleague, not as their supervisor. They were less intimidated of me. They could come to me for help. They could be honest with me. They could cry to me, things that like they wouldn't do to their supervisor otherwise. And it really helped, I think, helped me reach them on a level that, you know, their program director couldn't necessarily reach them on. Not all of them, but the ones that I did get closer to. And, you know, the same thing with journalism. I remember when I was at ABC and I was working their med unit, and I told them like, hey, I want to go on air one day, and I want to be a voice, and I want to help spread informative public health knowledge. And I met with a woman there who she's super successful and doing great things. And I asked her, like, how do I get to, you know, maybe where you are one day? And it was her and another guy. He was a producer there. And they both looked at me. They're like, give it time. When you look older, people will take you more seriously.
Oh my.
And I was like, man, that's going to take me so long. Like, what does that mean? I got to dye my hair gray? Like, I got to like put wrinkles on my face? Like, and I looked and I was like, okay, most of the medical correspondents on air look older. Like, or like there's this image of what a physician should look like, an educated physician, a leader should look like. And I just was like, all right, well, cool. I'm like, I let it bother me. I left New York and I was like, I'm not going to let that change anything, because seeing the movements that have happened around America and like people fighting for women, young females, minorities to come, you know, reach levels that they've never reached before, to, you know, at the amounts that they've never reached, really taught me that this is just a story I'm telling myself. Other people told me this story, and I'm just going to keep feeding this story to hold myself down, because it's going to give me something to justify. Then I'm going to use it to validate myself later and be like, well, I didn't make it because, you know, I didn't get on air because I was young. Like that was just the story someone told me. I believed it and I let it become a part of me. And so I just didn't. And I just kept pushing and pushing and writing. And then
that's awesome.
Yeah. Just
I love that. So much like resilience and also faith in who you are. I mean, did you have, even though you were pushing and you were moving forward, were there days of fear? Were there days where you felt intimidated? Were there days where you were just like, I just can't do this anymore, but you still picked yourself back up?
Yeah, I had some hard days, not because of, definitely, not that long ago actually, but with covering the pandemic, you
Mhm.
know, the early stages was easy, you know, everyone had the same sense of urgency. There
Mhm.
was a sense of like
Mhm.
patriotism and helping each other and looking out for your neighbors and your friends and
Mhm.
strangers and all walks of life. And as you probably know, in the last couple of months, when we actually hit our surge here in Texas and we were in the red zone, people didn't care anymore. And there was a lot of politicization of public
Yeah.
health and
Yeah.
anti-masking and anti-this and
Yeah.
anti-that, and it's a hoax and they're lying to you and they want to induce fear and, you know, a lot of these things. And I will tell you that that is, as much as some people may not want to admit it, that is the minority of people. The majority of people are still what makes America great. I see
Yeah.
it in the ER. And so I'll tell you that I see every walk of life. And I will tell you without a doubt, even here in Texas, I work in 3 different cities across Texas. Majority by far are still selfless, kind,
Mhm.
wonderful people. But it's the minority that really, they're the trolls online. They're the ones that come
Yeah.
at you, that can be mean. And, you know, you go on air and it's like, you never know who's going to come find you on social media or look you up or
Yeah.
contact your NGO or whatever. And some of them are hilarious. Like the things they would say, I was like, is this serious? Like it would just make me laugh. Like, is this like, it wouldn't affect me at all. But, you know, some of them just like hit a nerve. Like it was very few, overwhelmingly the minority of responses I would get to interviews.
Mhm.
But there's always that person who doesn't believe in science. It's like, dude, you're too young. Did you even go to medical school? Like comments like that just like, those are the ones that actually frustrated me, not the
Mhm.
ones that were like, this is a hoax, because it's easy for me to be like, well, okay, I'm sorry, you're not educated or informed. And, you know, I kind of felt bad for those people versus the ones
Yeah.
who would just like insult me for being female or being young and questioning me based on things that make no sense.
Right.
That would hit home. But, you know, it really reminded me through all of that I don't think we give enough credit to the men in our lives who kind of advocate for us and support us. And
Yeah.
my husband, my dad, and my brother, without a doubt, since I was, well, not my husband, I didn't know him when I was a kid, but when I was a kid, my dad was always like, you can do anything your brother can do. And my brother's like
Mhm.
unbelievable human being. Like there's
Yeah.
no way I can do like 10% of what he does. My dad was like, you can do it. Like there's nothing that sets you apart. He would play, you want to play baseball? Go play baseball with him. You want to go to med school? There was no, like, to this day, he has been my like biggest cheerleader. And my brother, oh my God, he's my biggest role model always.
Yeah.
And, you know, I feel very lucky that I married a man who is always, always there to push me further and lift me up and, you know, just really motivate me. And I don't think the
Yeah.
men get enough credit for the ones who support women, because they're the ones who are going to make a lot of these changes, you know, for our
Yeah.
world.
I think that's absolutely accurate what you just said. First of all, your husband is a gem. Second of all, it is accurate. Like, you know, I think the men in our life also, whether it be a woman or a man, the moms, the dads, the brothers, the sisters, the mother-in-laws, the father-in-laws, even your own children, like having that support system can be life-changing. And if they believe in you and they are your champions, right? And so it just becomes so much easier. Even the trolls become easier to handle. And
Right.
yeah, and I think also knowing, having a sense of self-worth, also knowing like you're so educated, you're so accomplished, you have seen parts of the world only a small fraction of the people of the world have seen. And not only that, you've done work in ways where not even a minority have done, right? So it's just like a small percentage. And so there's so much more of you that people have not seen or don't know about, but you have done so much. So tell me, I love asking this question. You already kind of hinted at it, but I'm still going to ask you, is what's your anchor when things get tough? What's your anchor? What is the thing that keeps you steady and makes you move forward?
Oh man. That's a good question. Um, I would say number one, without a doubt, is my husband. There is like constant source of support. And, I feel like as a woman, maybe as a woman or maybe anybody, it's easy to get in my head and easy to, lose my sense of self-worth, or feel like my efforts are futile, or get frustrated that maybe I'm not doing things right. And I think having that like rock in your life as a person is always something that is healthy for anyone. And so he's definitely been that since day one. And yeah, my family, my mom, my dad, and my brother, I'm endlessly close to all three of them. And my sister-in-law has really been like the sister I never had. And so at any point in any day, no matter what time of day it is, I can pick up the phone and call any of them. And I know very certainly that I will always laugh hysterically on one of those calls, because if you know my family, they're all like hilarious. And I will always leave feeling really great and loved. And, in whatever way that is, if it's like, hey, you're doing a great job,
right.
It's not necessarily like, we don't like boast each other up by any means, it's just like a normal family. Like we don't talk business to each other, but, just getting to pick up the call, talk to like my brother or my mom or my dad and be like, hey, like I had a rough day, and just knowing they're going to make me laugh and make me feel awesome and loved at the end of it. It's like, what else can I ask for? Like nothing else.
Yeah.
I wouldn't want anything else in this world. That was enough.
That's awesome. I love that. I think having a strong family unit and just trusting in each other, and it's okay to boast about each other. Totally fine. Why not?
All I'm missing is a puppy. And one day I'm going to go get a bunch of puppies and just have a bunch of dogs at home. I always tell my husband, I'm like, all I need is a dog and I'm set for life.
How funny. Okay, we're going to talk about some fun facts as we're ending this conversation today. So tell me, what's your favorite book?
Ooh, my favorite book.
Or one of your favorite books.
Yeah, so I really love The Tipping Point, as I've alluded to, I feel like, in this podcast. But anything by Malcolm Gladwell or Atul Gawande, they're my two favorite writers, have really resonate a lot with me. I love The Tipping Point and Blink and Outliers and all of Malcolm Gladwell's books. I've read them multiple times just because they really are so applicable to everyone in life, and really make you look at the world and human interaction so differently. And I love Tipping Point was great. It was the first book I read from Malcolm Gladwell, and I was hooked. I was like, this guy is unbelievable. And I love writing, and I was like, this guy is an unbelievable writer.
I love it.
So
I might just title this podcast Tipping Point.
Yeah. Incredible tipping point.
Incredible tipping point. But it's so true, because you're right. You keep talking about tipping points, and then you talked about, someone that you had met who was like, take advantage of those tipping points. And so I think it's such an important thing to like reach out and tell other, not just entrepreneurs, but people even in their professional journey, that when you do have a crossroad, make a thoughtful decision and not be complacent, because being complacent is making it easy, and you never grow in comfort. You never grow in comfort. So I think that's so true. Okay, back to the favorite though. What is your favorite magazine or blog or IG that you follow, like Instagram account?
My favorite Instagram account I follow, it's not even a big one, but it's called Kindness News. And they post the most heartwarming stories that are just, I've actually just started following them since our surge hit us in Texas, and life is just stressful every single day for us. So, I mean, it's great. They post the sweetest things, and I love the elderly people. My husband will tell anybody, like, I love grandparents and great grandparents.
Yeah.
Anyone over the age of 70, it's like I want them to be my best friend immediately. I love talking to them. I love hearing their stories. They're always just so great. And this Instagram account posts really great stories of the elderly, the disabled, kids, everything.
I'm gonna go look into them. That's so cool. I love that.
That's cute.
I love that. So where can people find you if they want to see all the wonderful work that you're doing?
Yeah, so it's Natasha Kathuria MD is the handle.
Okay,
And
I'll be
so,
putting that in the show notes also. But
yeah,
I had such a fun time listening to you and your story and all the amazing impact and legacies that you're leaving behind and, stamping in this world. So thank you for all that you do.
oh, thanks, Kirjan. Thanks for all
Incredible.
you're doing.
Well, I'm just happy you're on my podcast.
Oh, I
And
hope I
then,
get to see you in person soon when all this
yeah, we need to
madness.
exactly. You guys, next time you come to Houston, we're gonna get
Yes,
together, even if it's like in our front yard.
right, right. Lawn chairs.
Totally have two permanent lawn chairs in the front, which have been
Perfect.
removed because we thought the hurricane was coming here. But,
That's so
well, thank you,
awesome.
thank you, thank you, and good luck being in the front lines and sending you and your entire team all the best wishes from here.
Thank you. It was so great to talk to you. Have a great one.
Thank you so much for joining Law Chat with Girija. I love these kind of stories and conversations where we can be real, honest, and open, and having fun at the same time. I hope you are inspired and motivated to keep doing the amazing work you are doing. If this is something that gave you all those feels and then some, truly motivated and inspired for you, you can show your love in all or one of these ways. Be sure to give this video a thumbs up, subscribe, and share this video with your community and tell them about it, or share with somebody that can benefit from it. I look forward to seeing you next time on another episode of Law Chat, and until then, keep moving forward. Bye.